ABC 10 News at 5 starts right now.
The Dixie Fire nearing 500,000 acres. Local crews are now in Northern California helping with the firefight. The one thing that's making it difficult to attack the fire.
Plus, cases of COVID-19 exploding across the U.S. Why some doctors are describing the situation as a humanitarian crisis.
And why a dramatic video posted by the San Diego County Sheriff's Department showing a trainee collapse after being exposed to fentanyl is being met with skepticism.
ABC 10 News at 5 starts now.
The massive Dixie Fire in Northern California has been burning for nearly a month, and now it is the second largest in state history. Good evening, I'm Lindsay Pena.
And I'm Steve Atkinson. Thousands of people are under evacuation orders tonight as that fire has grown to burn nearly 500,000 acres. It is currently only 21% contained and has destroyed at least 400 structures. A cause has yet to be determined, but the utility, PG&E, reported equipment failures last May that may have been connected to the ignition of the fires. We have team coverage on the conditions and the role that local fire crews are playing in this firefight. Let's begin with ABC's Morgan Norwood.
The Dixie Fire once again exploding in size, now the second largest wildfire in California's history. Firefighters racing to contain the spread, but surrounded on all sides as they drive through the flames.
Left behind a lot of stuff. Fires ravaged through everything.
More people told to evacuate as the Dixie Fire now threatens 14,000 structures, already destroying more than 600 homes in the entire town of Greenville since it started a month ago.
It's scary when you sit there and see all the smoke coming over the mountain and wonder, where's it at? Because you can't see it.
Further north, the McFarland fire raging, only 21% contained as aircraft reinforced containment lines with retardant. As these wildfires tear through the West, the United Nations sounding the alarm on the global climate crisis. In its strongly worded climate panel report saying it's unequivocal that human influence has warmed the atmosphere, ocean, and land.
The report published today echoes the same messages with much higher urgency. Climate change is already more visible, and the emissions have grown more rapidly than we ever expected in 1979.
And that report goes on to say there's a chance to reduce that global warming, but in the meantime, experts warn that we'll continue to see that extreme weather, including wildfires and hurricanes. Morgan Norwood, ABC News, Los Angeles.
And local firefighters have also traveled north to help with the Dixie Fire. ABC 10 News reporter Mimi Alcala joins us live from National City, where firefighters from there and across San Diego County, they're all helping. Mimi.
Yeah, battalion chief who is usually at this fire station here in National City is up in Northern California working as a public information officer on this incident. We were able to catch up with him earlier today to see how things are going for our local crews up north.
This fire's been actively burning for the last 4 weeks.
The Dixie Fire has been burning in Northern California since July 13th, continuing to explode in size as the weeks go by, wiping out the town of Greenville, destroying homes, buildings, and hundreds of thousands of acres. Parts of 4 counties remain under evacuation orders.
So this one's big, and the fire behavior is very extreme up here.
National City Fire Department Battalion Chief Mark Beveridge spoke with us from Susanville, where he's currently stationed until the 18th, serving as a public information officer for CAL FIRE on this incident. He says smoke has been an issue, making air attacks difficult, but crews have had a couple of good weather days, although he says they're preparing for strong winds this week.
We have meteorologists that are on the teams, and so when they start predicting those things, our tactics change a little bit. They might go a little bit from a direct tack to an indirect tack.
Nearly 6,000 firefighters are battling these flames, including teams from San Diego County.
We call it a mixed strike team. There are San Diego, Poway, National City, Chula Vista, anybody that has an OES that's available, we'll put into a strike team. And we all train together, so it's almost like it's seamless for us.
The San Diego Fire Rescue Department shared this video last week, taken from a strike team leader's vehicle. And the Chula Vista Fire Department shared these photos from a captain that was on deployment there, showing just what firefighters are up against.
Every year, it just seems to get bigger and bigger.
And Beveridge really wants people to know that when local crews are sent to any fires to help out, they always make sure they have enough staffing back home in case anything were to happen here. We're live in National City. Mimi Alcala, ABC 10 News.
Thank you, Mimi. And powerful winds and bone-dry vegetation are fueling the Dixie Fire. ABC 10 News meteorologist Angelica Campos is tracking the weather conditions for that firefight. Angelica.
Lindsay, and the fight is tough. The weather is definitely going to be one of their biggest issues over the next couple of days. Over the last 5 days or so, at times we can see the smoke just rising into the atmosphere, but today that's not the case. You can just see how hazy it is out there. The temperature is at 90 degrees, the winds coming out of the southwest at 5 miles per hour and gusting at times at 50 miles per hour, so that's definitely a concern. But what's ahead for them? The temperatures will be rising. For now, poor air quality, which makes it incredibly tough for the firefighters. The temperatures ranging in the triple digits potentially by Wednesday and Thursday. And there is research that shows that at times some of that smoke can have impacts up to 9 months after a fire. So it's not just now, this could have some long-lasting effects.
Angelica, thank you. And now to the latest on coronavirus here in the county. 869 new cases were reported today. We had no new deaths in the county to report. Americans young and old, they are filling up hospital rooms with COVID-19 at an alarming rate. The number has grown more than 300% since last month. The surge is now being driven by the highly contagious Delta variant. As ABC's Faith Abube explains, some doctors are describing this situation as a humanitarian crisis.
The calls for more Americans to get vaccinated and quickly growing louder as the Delta variant breaks some grim pandemic records. Health officials say the U.S. is recording more daily COVID cases now than at any point in the first 8 months of the entire pandemic. Sources telling ABC News by mid-September, the Pentagon will add the COVID vaccine to the several other vaccines required for all military personnel.
This Delta variant is an entirely new and unexpected challenge for us.
The U.S. daily COVID average rising to just under 100,000, nearly 9 times higher than it was in the middle of June. So far, the states with the lowest vaccination rates appear to be the hardest hit. Dr. Peter Hotez on MSNBC.
What we're looking at right now is a humanitarian catastrophe.
New CDC data shows every state in the country is seeing high or substantial community spread. From Mississippi to Louisiana and 41 other states, hospital beds quickly filling up. In the Austin, Texas area, COVID patients flooding hospital rooms, leaving only 6 ICU beds available for about 2.3 million residents.
It's impacting all of us, and it actually is beginning to threaten health care for people with other problems.
The upcoming school year also drawing attention to younger Americans. One Florida hospital now caring for more than 20 children admitted with COVID, one on a ventilator. New Orleans Children's Hospital also treating more kids with the virus. But Dr. Ashish Jha says a simple 5-point strategy can keep kids safe in the new school year.
Number one is we got to get everybody who's eligible vaccinated. Second is we've got to do a lot to improve this air quality in schools, ventilation, filtration. Third, it's testing.
And Dr. Jha adds that mask wearing and avoiding super crowded spaces will also be key. In Washington, Faith Abube, ABC News.
Community has come out to support us.
And some healthcare workers, they are pushing back on the COVID vaccine mandates. America's healthcare workers for medical freedom rallied outside Rady Children's Hospital this afternoon. This group is advocating for their freedoms and right to say no to the vaccine. In fact, one registered nurse we spoke with believes the mandate is a huge government overreach by Governor Newsom.
Nurses are the ones that don the N95, we don our PPE, we don whatever's necessary to go into a patient's room. So whether I'm vaccinated or not makes no difference of how I'm interacting with my patient. Vaccinated or not, you can spread the virus.
Rady Children's released a statement and says they do not endorse this event. They say they are committed to the health and safety of the community's vulnerable populations and care for their patients.
A new study found people who got a booster shot had similar or fewer side effects to their second dose. We're taking an in-depth look. Israel began administering Pfizer booster shots to fully vaccinated people 60 and older last month. More than 240,000 people have gotten it. 4,500 participated in a survey about their booster. 88% say they felt similar or better compared to how they felt after their second dose. Infectious disease Dr. Peter Chin Hong says the data is encouraging.
It should provide a lot of comfort. I remember the folks in Israel were older folks, they were over 60. They also have a lot of medical conditions, and the fact that they experience it very benignly was a good thing.
31% reported some side effect, with the most common being arm soreness. 15% had other symptoms like tiredness, muscle ache, or fever. Less than 1% suffered from difficulty breathing. 1% had to get medical treatment. U.S. officials have said a booster for the general population is not necessary at this time. Dr. Chin Hong says based on the data, he agrees.
And for right now, even in the elderly population, we haven't seen folks going to the hospital in droves, amounts of vaccinated in the United States.
Booster shots could be approved for the immunocompromised in the coming weeks. People in that group have had a lower immune response to the vaccine.
And starting today, Americans can cross the border into Canada. U.S. citizens must show proof of full vaccination and a negative COVID test within 3 days. People wanting to cross into Canada must also fill out a detailed application online. On the other hand, the U.S. extended its closure to Canadians for non-essential trips until August 21st.
Medical experts are drawing skepticism about the video of a San Diego sheriff's deputy who reportedly overdosed on fentanyl on accident. We first showed it to you last week. ABC 10 News reporter Jennifer Kastner is joining us. And Jennifer, specialists tell you that his symptoms don't appear to match the story.
Lindsay, that's exactly right. There are a lot of questions being raised about how exactly this happened. We are still waiting on the sheriff's department to release the full report, which was expected to happen sometime today.
The dramatic video that made headlines nationwide, now raising concerns from some health experts.
I would say there's zero chance that it was caused by fentanyl exposure in this case.
Monday, Professor Leo Beletsky with the UC San Diego School of Medicine weighed in on the body cam video released last week, where a San Diego sheriff's deputy is seen falling to the ground after reportedly coming into contact with the opioid fentanyl while he was processing drugs at a scene. He was given Narcan to reverse the effects and has since been released from the hospital. The undersheriff said Friday that he was wearing gloves at the time, but the thought was that he either inhaled or ingested the powder through the air or skin.
You're saying it's biologically impossible to overdose to that extent that quickly just by touching the substance.
Yeah.
Professor Beletsky said fentanyl would take much longer to overdose on, either through the skin or by breathing it in.
You would need to be in a room where lots of powder was constantly in the air for hours in order to start ingesting enough of it to experience these symptoms.
The symptoms being displayed are not consistent with an opioid overdose.
Medical toxicologist Dr. Ryan Marino with the University Hospitals of Cleveland said an overdose would result in a loss of the airway.
The officer who is experiencing the symptoms is breathing on his own. He is maintaining his airway, even looking up close at his eyes, which are open, which would also be kind of atypical. He doesn't have the pinpoint pupils that we would expect to see. He never kind of loses his coloring, doesn't turn kind of blue.
He suggested that the deputy may have experienced an episode of severe panic. According to the American College of Medical Toxicology, the drug must enter the blood and brain from the environment. Toxicity cannot occur from simply being in proximity to the drug.
It gives people an erroneous idea of what an opioid overdose looks like. I think it unnecessarily stresses out first responders and other people who may be in contact with someone who's overdosing.
And we reached out to the sheriff's department for an interview or a statement, and we are still waiting to hear back. Reporting live tonight, Jennifer Kastner, ABC 10 News.
All right, thank you, Jen. Very interesting.